Our next speaker is Dr. Daniel Kraft. Dr. Daniel Kraft is a Stanford and Harvard-trained physician scientist and healthcare innovator. He is a well-known thought leader on the future of health and biomedicine. He serves as the faculty chair for medicine at Singularity University and chairs the X Prize Pandemic and Health Alliance. Daniel is an Aspen Health Innovation Fellow and a Kaufman Fellow. He is the founder of Exponential Medicine, Digital Health, and Continuum Health Ventures. His talk is titled Testing the Limits with Exponential Medicine. Please welcome him to the stage.
Shukran. Thank you very much. It's a great honor and pleasure to be back in UAE, in Dubai, such an exponential country and mindset. And you know, health is wealth. And we have all these incredible technologies all around us that have reshaped and disrupted, entire industries. How we do our banking, how we get our entertainment, have all shifted. Our worlds have been disrupted in good ways, and we've seen the pandemic disrupt our world in challenging ways the last couple of years. And the pandemic has helped us see that while many other technologies have reached the fourth industrial age, healthcare is sort of stuck in the second or the third industrial age. And I like to think about COVID as a bit of a catalyst. It's been the chief transformation officer. Just like Sputnik has sparked the space age, COVID is sparking a bit of a new health age. And I'm an optimist. Hopefully we'll save more lives, the innovations that come from COVID innovations that have been taken by it. So as you look into the future, what do you think about? The four walls of a hospital? Well, in this new exponential age, we're going from hospital to homespital. We're changing where and care happens. We're going from lab to laptop with how we do our research. And the research that's been accelerated in the time of COVID has brought us incredible vaccines that are saving millions of lives. But still in 2022, we're still sometimes based in the era of the fax machine. When I go back to visit Stanford, where I trained, or Mass General Hospital, we're still using paper forms, fax machines, old-fashioned mindsets. I had my own cardiac study done at Stanford. I could only get my results in a CD-ROM. I don't even own a CD-ROM player anymore, right? So the challenge is we're still stuck in the mindsets of waiting rooms and silos as they've been designed for years in healthcare. But we're not just defined by body parts. We're now in this genomic, connected, multi-omics age. How do we break open the silos? How do we help government services connect the dots to bring the potential for health and medicine to the population? Part of that's about mindset, because today we don't practice healthcare, we practice more sick care. What do I mean by sick care? Sick care is our usual model. We go and get very intermittent episodic data in the four walls of the clinic or the emergency room. And that intermittent episodic data leads to our reactive mindset. We tend to wait for the patient to show up with a heart attack or a stroke or diabetes, or in my field of oncology, a late stage cancer. And it's our potential moving forward to take all the new amazing technologies that are here and emerging, to be much more continuous with our data, much more personalized, much more proactive, and start to bring care anytime, anywhere, arguably at lower costs with better outcomes. And move the needle not just on treating disease, but precision wellness, optimizing not just our lifespan, but our health span. And to even think about extending our longevity and even reversing aging. So it's an exciting time, and I think government and government services helps catalyze this whole healthcare continuum. I'm not going to go through very quickly. Now, the future of medicine's in the zeitgeist. I wrote the opening article for National Geographic 2 years ago. And many of these emerging technologies are exponential, just like Abu Dhabi and Dubai are riding this new trend. Technologies at their exponential are where disruption and change happens. Moore's law is accelerating the power of computing on small chips, and soon we'll have quantum computing. But even with our magical smartphones of today, we have incredible healthcare potential, right? My iPhone 2 from 12 years ago, it was amazing 12 years ago. Now it feels slow and clunky. My iPhone 13 will soon be antique and will dissolve into my augmented reality glasses or into my smart virtual reality contact lenses, which are coming to market in the next year or two. And even with our sensors of today, we can do some pretty incredible things. We can design them to enable us to do an ear check on our kids to see if they have an ear infection. Or the rise of the medical selfie. Instead of bringing your urine to the lab to check for a urinary tract infection, or for a pregnant woman, or if you're screening for a patient with diabetes for kidney problems, you can now take a picture, click the picture, the AI and the machine learning can make the diagnosis and send it to your doctor or the pharmacy right away. Instant diagnostics. So on this exponential, what used to fit on a desktop now fits on your smartwatch, which are becoming FDA-cleared medical devices. And now we have this whole digital era of health and medicine, digitized, democratized, and demonetized. And it's shifting how and where we can do things, from services to data. And I think we'll make the next 10 years look slow. Because remember, not just Moore's law, but a Mars law. We tend to underestimate what can happen in the next 2 years and overestimate the near term and underestimate the long term. And I think the next 10 years will make the last 10 years look slow. So let's together reimagine what we can all do together in this future of health and medicine. Starting with now this Internet of Medical Things, running 5G, soon 6G, making terabytes of data from our wearables and our connected homes and our genomics, massive amounts of data, but often that data is siloed. It doesn't connect. It can create an infodemic. I think part of the role of government and new smart services is to incentivize going from big data to actionable information and insights, and to narrow the gap from learning to what can be used at the bedside or at the website. And to also align incentives, not to just pay for sick care, but to pay and reward healthy behaviors in the community, at the public schools, and at the education level. Part of the shift, of course, is incentivizing care from hospital to home, to our phones, to inside our bodies. A lot of care can now happen at your corner pharmacy, or of course on your telemedicine app. And that's giving us this era of mobile, connected, or what's often called digital health. I think of digital health as the ability to connect the dots between the data and make it useful for the individual, the policymaker, the government, the school system. And to leverage many of these new apps. 10 years ago I gave a TED Talk, The Future of Medicine. There's an app for that. We're 25,000 apps. Now there's 250,000 or more health-related apps. How do we take this era, not just think about apps and digital, but layer on AI, blockchain, nanotech, genomics, virtual reality, AI, to really bring us this future of convergence? Technology meets healthcare, creates entire new fields. And for those of you in government, provides this ability now to address many of the grand challenges we have here in Dubai and around the world, from aging populations to fragmented data to who pays and who regulates as we accelerate into this future. I've been sharing this XPRIZE Pandemic Alliance Task Force through the pandemic, and what was magical was to see over 100 NGOs, governments, startups, Fortune 50s come together to help solve for PPE, diagnostics, and testing. And to realize that it's not just about technology, it's often about what's called our social determinants. Where we live is more impactful, our zip code is more impactful than our genetic code. So how do we understand our social determinants and even our digital determinants? Do people have a digital plan? Do they have high-speed access? How do we now bring 50% of the world's population online and open up access to healthcare that didn't exist in the past? We're seeing new services like in the United States, Medicare pays for Uber Health that can bring patients to clinics and nurses to bring vaccines to folks. So this Uberization of healthcare is around us. Amazon is bringing Amazon Care across the United States, at least, blending virtual and digital care. And all this, of course, is disruptive. Many companies from the past have gone bust, Kodak, for example. We want to be the disruptors, not the disruptees. We want to be Ubering ourselves before we get Kodak in healthcare and beyond. So let's look at three key areas. Let's start with health and prevention. We know that most of our diseases are actually driven by our bad behaviors: poor diet, smoking, stress, not enough exercise. Now we're in a time where we can start to measure and quantify our behaviors. I'm wearing like 5 different wearables. I'm sure many of you have them on. And these sorts of wearables can now measure almost every element of physiology and behavior, from patchables to simple Fitbits that can track a patient when they go home from a total hip replacement. Are they walking more and doing better, or walking less? If they're walking less, maybe we can intervene early. And this is going to take us from an era where many of us are data geeks. We have quantified self, our data on our phones, to quantified health, where through government services and smart data flows, we'll interact with your clinician, enable us to optimize prevention, diagnostics, and treatment. There are now smart patches that are coming to market. They can give you basically an intensive care unit level of data from a simple patch that will last a month, bringing streaming information to anybody who needs it. Blood pressure can now be done without a blood pressure cuff, and our next generation smartwatches will do blood pressure, and they'll also maybe even do blood sugar without a needle or beyond. We're going from wearables to insidables, sensors in our contact lenses underneath our skin that can transmit health information wherever we might need it. And beyond that, hearing devices, ringables, this small ring I'm wearing called the Oura Ring, all this exponential technology coming together can let me track my sleep, my health, but also, if I was a pregnant woman, could predict pregnancy early, or if I've had a COVID vaccine, can predict my response to the vaccine just from a wearable device. Other technologies are emerging to measure your breath, whether you're going on a social engagement or to track whether you might have signs of early cancer. Underwearables are coming to market, sensors that are so cheap and available, Internet of Medical Things in your underwear bands that can help track a patient from home. And with new incentives to pay for remote patient monitoring, we can shift how and where care is being done. We can also start to measure our most important drug, food. We can measure our input, how much calories we're taking, what kind of quality of food. We can also start to measure our metabolomics with continual glucose monitors, and we can measure our outputs in more seamless ways, right? And so that's going to take us to a future of precision nutrition, right? Optimizing based on your genome, your microbiome, your metabolome. But we don't need to wear anything today. Our invisibles, our cameras today can pick up our vital signs, our blood pressure, and share and make sense of that information. So we're entering a time now where we don't need to wear anything. Our voice can be a biomarker to neurologic health, mental health, the sound of your voice or a cough. Is that a common cold or is that COVID? Wi-Fi can pick up the vital signs of 10 or more people in the same room at the same time. So whether we like it or not, our digital exhaust is being collected, our digitome. Who owns that data? Do you own that data? Does the government own the data? Does big tech own that data? How do we make and incentivize that information to flow to optimize care? How do we integrate that data into the workflow of the overworked clinician, doctor, nurse, pharmacist, who's often being burnt out by the data, and it's not smartly designed into care? So as we move forward, we now can see that we can integrate this. Our smartphones can take our digital exhaust and start to make sense of it. We're moving into an era of what I like to call predictalytics. Imagine a FICO score, integrating your sexual health, your financial health, your mental health, your data, so you have your own personalized check engine light that can give you early warning. We can already see that a wearable device can pick up who has COVID even when they're asymptomatic. So we're entering a time when we can really start to make sense of this data in new forms. But just because we have the information doesn't mean we're going to change our behavior. Behavior change is hard, so we need help with that. Digital coaches are here to match our age and our personality. They need to be designed based on age, culture, language, education level. Some of these avatars will match exactly who we need to hear from to optimize our health in this sort of virtual internet of life. Even voice can be used, whether you're 9 or 99, anyone can interact with voice to help their health care. And imagine this not so distant future, we each have our own personal health coach. We see in the mirror not just you of today, but you of the future. If you're working out, you're doing your Peloton rides, or you of tomorrow if you keep having pastries for breakfast. I can see myself today, I can see myself 1,000 donuts later. I will only have one donut, right? Or if I see that, what's gonna happen if I smoke? So this brings us to a new era of augmented, virtual, and extended reality. It's bringing us new ways to see the world for clinicians to pull complex information and make sense of that in the operating room, or to be guided step by step through different surgeries. It's bringing us new ways to educate our patients so they can engage with their own health and understand the implications of healthy or bad behaviors. It's giving us, there's my son looking at his interactive physiology. Virtual reality is not just for video games today. It's fun to put grandma on a roller coaster, but we can use virtual reality to treat pain patients, or being leveraged now to treat and use for physical therapy, for engagement and gamifying. It's shifting and reimagining surgical education. So instead of see one, do one, teach one, you go into the virtual operating room and practice until you get it right. It's changing the way we can do virtual coaching and bring expert surgeons anywhere virtually around the world. And eventually, we're going to build a bit of a Waze for clinicians, learning from thousands of procedures, making an average surgeon an expert surgeon, and going from driver assist to essentially doctor assist. We're already starting to see this era of automatic robotic surgeries come to reality. Then, of course, there's diagnostics. We want to pick up disease early, not late. Here's my own brain. It comes with color-coded AI. And the scanners are getting cheaper and more available. I had my full body MRI done in 45 minutes. In 5 or 10 years, you go to your corner pharmacy, have your entire body scanned, and the AI radiologist will give you the results. We're seeing smaller scanners that are portable. I had my own brain MRI'd while on a boat riding on the Hudson River in New York City in 5 minutes a couple of months ago. So with these new diagnostic tools, we can bring care and diagnostics anywhere. It can augment our virtual visits. It can make our stethoscope smart. It can bring an AI-powered ultrasound device that used to be $200,000 and bring it anywhere around the world, democratizing diagnostics. The laboratory in a chip can fit on our smartphones now and bring us laboratories that used to be limited to central facilities. And this can, again, democratize healthcare to places like rural Africa, where taking today's technologies can upskill and uplevel clinical care teams. Another era that's emerging is the ability to leverage our genome. The price of sequencing a genome has dropped at twice the rate of Moore's Law, from $1 million 10 years ago to basically $300 today. We can take our complex genetic information and pick the right drugs and the right doses, or understand diseases like diabetes at their genetic level, and start to build our multi-omic stacks to more precisely treat diseases like diabetes. I visited a startup here called GluCare in downtown Dubai just yesterday, being much more continuous and having much better outcomes for diabetes. Of course, we need help to do that. AI, or I like to call it IA, intelligence augmentation, is going to obviously shift how we do radiology. It's shifting how we can do colonoscopy to do smarter screening and pick up lesions that might have been missed. It's coming to build this digital twin where each of us will be modeled and we can make sense of that data to be smartest about what we individually or our communities need. And AI can do some incredible things to designing drugs. There's a company called In Silico that's coming to UAE that is now in less than a year screen for, designed, and put into clinical trials drugs discovered by artificial intelligence. And of course, this won't replace the doctor, the nurse, the pharmacist. It's AI together with what humans can do that up-level and upskill all of us. Then, of course, there's therapy. All sorts of new ways of doing vaccine patches, for example, instead of needles and syringes. We're seeing virtual visits. Of course, you've all had your first virtual visits in the time of COVID, but now that's moving into the metaverse, where we'll interact with our clinical teams in ways that feel real instead of just on the screen. We're in a time of prescribing apps instead of just drugs. There's a whole new realm of digital therapeutics that are FDA cleared. And because there's so many of these tools today, I built a new platform called digital.health, where you can have a digital formulary for your doctors, your healthcare systems, to discover what might work. You might want to prescribe a connected EKG case to screen a patient who has heart disease. All these technologies need to be integrated into the flow and be paid for by the policymakers and payers. And my new venture fund is seeing incredible new entrepreneurs come into the healthcare space and innovate. Finally, there's now digital manufacturing, 3D printing. You can 3D print medical devices. You might even 3D print medications. Instead of taking 5 medications, what if you could print your own personalized polypill, one that's built for you and based on your own physiology instead of one size fits all? You can blend and match the pill that's based on the medications and the doses you need, and eventually print that at home to give you the doses and therapy for prevention, wellness, or disease therapy. So in closing, all these technologies are great, but unless they can get through clinical trials and prove their value, it's a bit of a so what. So in the time of COVID, we've been reinventing clinical trials. The digital trial is here, leveraging wearables, new forms of data, cloud analytics, and can accelerate what used to take 10 years and bring it down to 10 months. So our future is crowdsourced, just like our driving. Imagine 15 years ago, we used to drive with paper maps. Now we're building the Waze for healthcare, the Google Maps. We're all sharing data, but can bring it together. And government services can help incentivize each of us not to just be a blood donor or an organ donor, but to be a data donor. And if we take that exponential mindset, convergent thinking, we have the opportunity not to think about where we are in 2022, but to skate where the puck is going to be in 2032 and 2072 and your 100-year jubilee, to really reshape health and medicine in new ways, to go from our today intermittent reactive sick care to a future that's continuous, proactive, personalized, anytime, anywhere, crowdsourced, AI enhanced with aligned incentives and workflow. So let's together not take incremental steps, let's take exponential steps. Just like we see here in UAE and the Dubai, the future's already here, just not evenly distributed. It's up to all of us not to just predict that future of health and medicine, but collaboratively together create it to build a better health and medicine for all of us here on Spaceship Earth. Thanks very much.